Hello, 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 my lovely nurses. How are we all doing? What's shaking, babies? I hope you all had a good day. Today, we are about to learn something. You know how we do it. Your med said decoded RN. I am here to break your medical, surgical, nursing, diagnosis, and terms into simple terms for you. So without further ado or without wasting much time, let's go straight into the point. Today, I want us to talk about gallbladder disorders. Okay? And our main focus is going to be cholelithiasis and choledocholithiasis. Now, one thing I love to do, usually if I go on the floor and I'm taking report, I want to have at least a little understanding or a little bit knowledge of the conditions on the floor, right? So before I even attend to a patient or before I start my assessment, I want to have a little bit knowledge about what the patient has. So let's say if the patient has cholelithiasis, I want to know some of the signs and symptoms even before I go to my patient's room. That way I will be able to ask the right questions, basically. Okay? So cholelithiasis and choledocholithiasis. It's a big word, but that's okay. That's why you got your med said decoded RN. I'm going to break these down to make it simple and easy for our lovely nurses, our future nurses, and all our new grad nurses. So, cholelithiasis, basically, chole stands for your gallbladder, lith stands for stones, and isis is inflammation. So cholelithiasis is stones in your gallbladder that is causing inflammation. Now the question is, how come or how do we even get the stones? So one thing we should know is that your liver produces bile, and this bile is being stored in your gallbladder. Then it is the function of the gallbladder to move these bile into your small duct or through your small duct into your duodenum or small intestine. Okay, but maybe for some reason your gallbladder is not doing its work well. So there's a lot of bile being produced or a lot of bile being stored in the gallbladder, but it is not able to expel it out. So it gets accumulated, gets calcified, hardens, and forms the stones. Basically, that is how the stones are formed. And also, one thing you should know is your bile acts as an umbrella, in a sense that within your bile, we have bilirubin, we have cholesterol, we have bile acid, we have water. So it encompasses a lot. Okay, so all these things can cause the bile to harden or become calcified when it is not expelled faster. So that is how you get the stones. Now, if somebody has cholelithiasis, what are some of the signs and symptoms? The patient will be having right upper quadrant pain. And usually they describe the pain as a colicky pain. Let's break it down a little bit. Right upper quadrant pain. Why right upper quadrant pain though? Guys, you should know. Why? Because your gallbladder is located at your right upper quadrant. So it makes sense for patients to experience pain at the right upper quadrant area. And sometimes it does radiate to your epigastric. Okay, so if you know your anatomy well, you will know that your abdomen is divided into 9 good quadrants. So the right upper side is where you have your gallbladder. Now, I said they do talk about a colicky pain. What is a colicky pain? Usually they describe it as a cramping feeling, a wavy-like feeling. It's an on and off feeling, and that happens when there's contraction and relaxation of the muscles in your gallbladder. When there are stones in the gallbladder, this contraction and relaxation causes these stones to glide on each other and also glide in the lining of your gallbladder, and that causes the colicky pain. Okay? And it's usually after you eat fatty meals. Why? Because your bile emulsify fat. Okay, so when you eat something, your bile is being produced, stored into your gallbladder. There's secretion, right? And then secretion of the bile during digestion helps emulsify the fat in your body. Then we have nausea and vomiting, which comes with it. What are your labs going to look like? Usually for patients with cholelithiasis, their labs are usually normal. you don't really see any changes. It's only the signs and symptoms that they present that will make you think, okay, it's cholelithiasis. Diagnosis. Usually we do ultrasound in order to diagnose it, right? Then treatment. We have cholecystectomy. That is basically the removal of your gallbladder. So guys, next time you have a slice of pizza and then you start having an upper quadrant pain, you should be thinking there might be a cholelithiasis going on. Maybe, maybe not. So that is it. Now let's go to choledocholithiasis. That's a long word, but that's okay. We're going to break it down. So choledocholithiasis basically is stones formed in your common bile duct. Okay, so your common bile duct basically transports your bile from your gallbladder into your duodenum or your small intestine. But when there's an obstruction or when there's a blockage, which is usually when the stones in the gallbladder move into your bile duct. Okay, that is what causes the blockage. Now, when this happens, bile isn't going to be able to flow, right? Bile gets stuck. So what are some of the signs and symptoms? You are going to get right upper quadrant pain, just like your cholelithiasis. There's also going to be jaundice. Why is there going to be jaundice? Now, remember, your liver is producing bile and storing it in your gallbladder. With time, the gallbladder is going to be full. Then it's going to cause backflow of your bile into your liver. And that gets secreted into your bloodstream and causes that jaundice color or yellowish discoloration. And so if you have a patient with cholelithiasis, you should check the skin color very well. Sometimes you might need a proper lightening to see the change in skin color. And also the easier way is to check their sclera. There will be a yellowish or orangey discoloration, and that should tell you there is jaundice going on. Then we have your dark urine. Why do we have dark urine? So bilirubin, after the backflow, bilirubin is being filtered by the kidney. Now, when the kidney does its job, filters the bilirubin, the waste product is what comes out as your dark urine. Pale stool. So patients will usually have a pale stool. Why? Because the bile is what helps your stool get its brown color. But this is the situation where during digestion, bile is not coming out. So then your stool becomes pale or a clay colored one. Labs. So with cholelithiasis, patients usually have increased bilirubin. There's increased liver functioning tests, so your ASTs, your alkalates, and all that. Then diagnosis. We have ultrasound, just like your cholelithiasis. Okay, guys, now let's get to the treatment of choledocholithiasis. We have ERCP or MRCP. So ERCP basically is a combination of an aposcope and an X-ray, and that helps in removal of the obstruction. So it stands for endoscopic retrograde cholangiopancreatography. That's a big word, but we got it. And then we have the MRCP, that is magnetic resonance cholangiopancreatography. Okay? Now let's look at complications. We have choledocholithiasis complications. We have cholangitis, we have pancreatitis, we have sepsis. If you really know your anatomy, where your pancreas is situated and in connection with your common bile duct and all that, you will appreciate you would come to understand why we have these complications. Okay? Now, one thing you should know, cholelithiasis will cause pain. Choledocholithiasis is going to cause pain, and also it can kill. So, if you go to the ward, you see changes in your patient's color, if you see jaundice, if you see dark urine, you should start questioning yourself. You should bring it to your doctor's attention. Okay? So you know how we do it. We try to make nursing very simple, even though it's stressful. Your med-surg decoded RN, I'm always here to break things down for you. Thank you so much. And don't forget to subscribe to my YouTube channel, MedSearch Decoded RN, and also follow me on TikTok. Remember, we are learning together. So if you have any other comments, if you have anything you want to add to this, please feel free and add it. Thank you and see you in my next video. Bye.